Hello, my name is Catarina Djupsjo. I'm a resident in cardiology at Karolinska University Hospital in Stockholm, Sweden, and I'm registered as a PhD student also at Karolinska Institute, also in Stockholm. And I'm happy to tell you about our abstract, Preoperative Disturbances of Glucose Metabolism and Mortality after Coronary Artery Bypass Grafting. In patients with multivessel disease and diabetes, the recommended therapy is not PCI, but CABG. And approximately 40% of all patients undergoing CABG in Sweden have diabetes. But even though this is the recommended therapy in these patients, they still have a poor poor prognosis. And we wondered, what about patients with prediabetes? Do they have a poor outcome as well? So our aim with this study was to investigate the association between preoperative disturbances of glucose metabolism and mortality after CABG. So how did we do that? Well, we had 497 patients without known diabetes undergoing CABG at Karolinska University Hospital between 2006 and 2013. All patients underwent an oral glucose tolerance test within 3 months of their surgery. Our data was collected from SwedeHeart, the Swedish heart register, and by reviewing patients' medical records. And our results could be seen here. We had, based on the oral glucose tolerance test, we had 170 patients with normal glucose tolerance, we had 219 patients with prediabetes, and we had 108 patients with diabetes. Our findings here in baseline also illustrate some things known before, that approximately 2/3 of patients with cardiovascular disease have previously unknown disturbances of glucose metabolism, as you can see here. But back to our study. The baseline characteristics were pretty similar, except that patients with newly discovered diabetes were slightly older. We had a mean follow-up time of approximately 10 years. And if we take our follow-up time, our results from the oral glucose tolerance test, and we do multivariable adjustments for sex, age, BMI, hypertension, and so on, and do a Kaplan-Meier, it will look like this. And here we can see the conclusion of our result. Basically, there is no significant difference between the different glucose tolerance groups after CABG. Thank you.